Time to talk about Chapter 4, the integumentary system, also known as our skin. Our skin is the largest organ on the human body, or in the human body. Um, it provides so much protection from toxins, infection, UV rays, all sorts of things. It does absorb and allow nutrients, minerals, medications, toxins to get in the bloodstream. However, it's a slower rate of absorption compared to taking a medicine by mouth or injecting a medicine via muscle or intravenously. But the skin does a lot of good things for us. Derma is a Greek word that's used to describe skin. You'll see lots of terminology. Scleroderma, cutaneous refers to the skin, and is a word that is cutis is skin in Latin. So look, here we are still talking about Greek and Latin language. I believe this chapter also reviews some French related to the integumentary system. Okay, so anatomy of our skin. The outermost portion is the epidermis. And then you get into the deeper layers. You have keratin. Melanin gives us pigment in our skin. Many people are born with beautiful melanin, and as they age, the melanin can decrease or increase. Some humans can get out in the sunshine, and the sun produces, which unfortunately it's sun damage that produces the increased melanin. However, it's not the end of the world here if people of all types of races are out in the sun and their skin gets darker. That's normal. That is the skin's way of protecting itself, healing itself, etc. Melanin. The dermis is beneath the epidermis, is connective tissue. Then there's a subcutaneous level layer. This is a very busy diagram, this picture here, but it shows you all the things. This is like sweat glands. So the skin is made up of the epidermis and dermis, and then you have the subcutaneous tissue underneath here. Within the subcutaneous tissue, you have adipose, hair follicles, um, something erector. I don't know. I don't even know what that is. Oh, no, it's a muscle. I'm sorry. It's a muscle fiber. I was trying to make it something else. The arteries, the nerves, and the veins are also found in the subcutaneous layer. So if you think about that, if you've ever accidentally nicked yourself or cut yourself and it doesn't bleed, then you didn't get to the subcutaneous layer. You just damaged the epidermis, the dermis, the top layer of our skin. Within that layer, there's a lot of things here that are busy doing great work. Sweat glands can get infected, sweat glands can get clogged. Anyway, okay, so let me flip the page or I'll end up talking for longer than I should. Associated skin structures. Sweat glands, they produce temperature regulation. By the way, if you're outside or if you're exercising, if you're dancing, if you're doing anything that moves and you're a good sweater, like you sweat a lot, that is actually a great sign of your cardiovascular system if you're moving and doing stuff. Now, however, if you're just outside, sedentary, and you're just profusely sweating, that's not a good sign of cardiovascular health. But our sweat glands are part of the skin and they regulate our body's temperature. Sebaceous glands, they're oily. They produce the sebum that lubricates like our hair, fingernails, prevents drying out. In the wintertime when the air is dry, and especially like, if it's windy or, that you may have to put lotion on your skin, you may have to use some moisturizing shampoo and you normally don't. The wintertime really does dry our skin out. We have hair throughout our body, the hair follicles, you can read all that. Nails, there's so many things to nails. The nail, what do I want to say about the nails? Fingernails can actually tell a lot about a human's health too. Hair and nail contain keratin, both function and protection. Here's our terminology: cutaneous, dermis, epidermis. So here's the root word for hair. So this is what I'm remembering. Um, trick, tricho. I'm trying to find the whole word. You can Google some nail conditions and you'll see that root word listed there. So this terminology list goes over the key terms. Roots pertaining to the skin, derma, cara, mela, hide or hid, sebe. Yeah, trichomosis. Okay, so I wasn't sure if I was going to be correct when I said that, but yes, trichomycosis is a fungal infection of the hair. This happens a lot in athletes. This happens, oh, it can happen for so many different reasons, but that's one of the uh, root words for hair. And the onychia, this is an inflammation of the nail or the nail bed. So the oni is the root word for a nail, anything to do with a nail. Here's our exercise for this page. Let me see how far this goes down. Oh, so for your reference, here's some skin lesions. Ebola. Oh, and it takes, there's figures listed. Oh, yes, those pictures. I saw those pictures earlier. Great pictures, by the way. You can even go down a hole um, if you Google these certain type of lesions, and you'll find even more pictures if you search them out. But the book has some really good ones. These are all how we, in medical terminology and even in charting and documenting, we use these words often to describe skin issues, and they can be treated in multiple ways. Often you will have someone, many doctors, many practitioners say, if you have a papule or if you have a blister, leave it alone. Where ulcers and different, maybe even a nodule would require intervention. But you definitely, if we squeeze and touch our skin, if we're not supposed to, it leaves marks, it leaves permanent scars. So, anyway, clinical aspects of the skin, the study of the skin's dermatology. There's that derm root word again. Wounds, oh gosh, so many things. Wounds are caused by trauma, accidents, attacks, surgeries, therapeutic diagnostics, etc. You can scratch your skin, that is a wound. So many things. Our skin is strong, but it's not. Yeah, we can really damage our skin if we're not careful. So dehiscence is when, like for example, if somebody has a surgical scar and maybe it's in the abdomen, they're not supposed to lift something heavy, but they do, or if they cough really violently, that wound can open back up, and that's a dehiscence. Evisceration is when the wound is so deep that the actual organs can come out. They protrude outside of the abdomen, outside of that lesion, or I'm sorry, outside of that wound. As wound heals, fluids and cells drain from the damaged tissues. Yes, the drainage is called exudate. Maybe it could be clear, it could be sanguineous, it could be pussy, bloody, etc. Keloids. This is an example of a keloid. This is just a scar. This is scar tissue. Some people can cut themselves and have surgery, and the scar heals beautifully flat, like nothing was ever there, minimal. And then some of us, we just a small little skin injury, and we were left with a keloid. It's very common. They can be surgically removed, but guess what? The surgery is a trauma to the skin, so there's no guarantee that a keloid will not repeat. They're making some discoveries and some medicines and some lasers that can help, but that's just what some skin does. It's normal. Debride or debridement is when you remove the dead tissue to promote new tissue growing. That's what I was referencing just a few minutes ago, that the ulcers are something that we're like, we leave blisters and papules alone, but an ulcer we will actually do intervention, and that to debride a wound or provide debridement is to remove the old dead tissue. Thick, dark crust or scab, eschar, can be removed in an escharotomy. This really comes into play like with motorcycle accidents where patients have severe road rash or other reasons, but that's what that is, removal of that scabbed up tissue. Here's French connection to our medical terminology. Deep wounds can require grafting for proper healing. Absolutely, they can. Skin is cut, grafting with a dermatome. Burns. You can read this, you can review this. I will go ahead and tell you, in this area of North Carolina, you will not treat burn patients unless you are a burn center or a burn specialist. So just review this just for your own knowledge. The rules of nine, I remember that from nursing school. But like I said, we do not, the hospitals that I've worked at, there's only one burn center here in our area, and that's in Chapel Hill, North Carolina. And we just don't care for a lot of burn victims. However, again, this information is good for you to know. Pressure ulcers. Pressure ulcers can come from all sorts of things. Usually it is from when someone sits in the same position or lies in the same position too long. Whether you are in a medical office, a hospital, a skilled nursing facility, it is a law, it is ethical, it is a rule, expectation, whatever you want to call it, to turn a patient every hour to every 2 hours. You have to get people, you can't, you don't want pressure ulcers. Um, and it's to the extent now in healthcare that if a patient comes into your facility with no pressure ulcers, and then when they're discharged, they now have a new pressure ulcer from lack of care, insurance companies, Medicaid, Medicare, they will not pay for that hospital stay. So it's important that patients are not left to sit or to lie in the same position all day long. Dermatitis, oh, this can come from so many things. So read all about that. There's good information there. Psoriasis is a very common condition. Autoimmune, there's lots of great new treatments for psoriasis, though, in the ways of creams and UV therapy and lasers. Autoimmune disorders, yes, scleroderma, I mentioned that earlier. Lupus, lupus is unique. Autoimmune disease with connective tissue. Skin cancers are very prevalent, which is interesting because we, as a society, use sunscreen more than we ever have. So is it the sun or is it what we're putting on our skin? I don't know. Um, but skin cancer is common, very, very common. Squamous cell versus basal cell. And to be honest, they've come a long way technology wise and surgery wise on how to treat this. If skin cancer is left untreated, it will go into the deeper layers of the skin. If that area is close to bone, if it's close to muscle, if it's close to your bloodstream, it will metastasize. So skin, keep an eye on your skin, and I'm talking about skin from all races. Everybody needs to check their skin and be very familiar with your moles, your everything, any kind of growth you have. As long as it's normal, it looks good, it's not changing, then you're fine. Read about melanoma. That is a serious deadly disease, Kaposi sarcoma, associated with AIDS. Yeah, that's a terrible thing that could happen. So you're welcome to read all about that. Terminology: we got some atopic dermatitis, basal cell carcinoma, debridement, dehiscence, dermatitis, eczema, erythema. Here's more terminology. Read that, review it. Know if you see something on a quiz or something, at least you know where to go look for it because you've seen it before. Here's some of the pictures. You guys can read all about this. Impetigo. Impetigo is very common in children because they pick at something. They don't know to stop picking at it. They can get mosquito bites. They can do all kinds of, an ant bite can turn into impetigo just because of the itching and the scratching. They just don't stop. These are, oh, tinea corporis. So this is just a fungal infection of the skin. You know what? This is so easy to treat with just some like Head and Shoulders on their body. The Head and Shoulders shampoo that helps with dandruff can actually help with tinea corporis. And this comes from swimming in the pool too much, or athletes get this a lot on their skin because they're not showering as often as they should be. So quite easy to repair there. This is an ulcer. I can't tell what body part that is. That might be the lateral side of a leg, and somebody laid on that side too long. All right, I'm about to hit my time. Okay, good. Let me know if you have any questions about skin.